Clark. Welcome to today's webinar. My name is Doralyn and I'm a speech pathologist at Empower Healthcare. So today's webinar is all about safe eating, swallowing, and mealtime tips. But before I get started, I would like to acknowledge the lens of the traditional owners, and I pay respects to the elders of the past and present. So today, again, it's all going to be about swallowing. We're going to talk about how it works, why swallowing may change, what happens when it changes, and most importantly, what we can do about it. And just as housekeeping, I guess, there is a Q&A section that you can type your questions into as we go. So feel free to type your questions in as you think of it, and we'll answer them towards the end of the session. All right, so getting started, diving right into it, swallowing and how swallowing works. So we all swallow. We know what a swallow is, I'm hoping, but swallowing is more complex than we do think it is, if not the most complex thing our brain coordinates. Swallowing has multiple phases. It starts before the food enters the mouth. We call that the pre-oral phase. When it's in the mouth and we do the chewing and sending it back into the throat. So there's the phase where it's in the throat and then it enters our esophagus, our food pipe, and goes to our stomach. That's when swallow ends. So swallowing is partially voluntary and it's partially reflexive, meaning that if I ask you to swallow right now, you're able to do it voluntarily. But at other times when we're just sitting down watching TV or just relaxing, we also swallow, and that's the reflexive bit of it. It happens without us thinking about swallowing. And we use touch, taste, smell, and sight, all of our senses, to help us swallow as well, which is why I said it starts before the food enters your mouth. We use these senses to give our brain the information to plan the swallow and safely swallow accordingly. So for example, we might see some eggs and we are taking in the information of what the food is, what the texture might be, and how, I guess, strong our swallow needs to be, how much we need to chew. All of that our brain plans before the swallow even starts and the food enters our mouth. So that's one reason why a swallow, it's more complex than you think it is. The other bit is that we use at least 26 pairs of muscles and 5 cranial nerves for a swallow to happen effectively and safely. That's a lot of muscles that go into play for a swallow to be safe. So I do want to show us a video of what a normal swallow and an abnormal swallow might look like. So just some orientation to what we're looking at. These are x-rays of swallows, and as speech pathologists, we can do these as assessments to look at what's happening on the inside when you're swallowing. So I'm looking at this person from the side, and if you follow my mouse, that bit that is cut out of that video is where your lips are, and that's your mouth, your teeth, that's your throat, that front white bit here that I'm circling, that's your trachea, so your windpipe, where air goes into your lungs and out. And right behind that, it's sitting closed at rest, so you can't quite see it until the swallow happens. That's your food pipe, your esophagus sitting right behind. And you can see your spine and all of that in the back here. So that's just some orientation for us. I'm going to play this video, and it will show you some fluids being swallowed. So you see that entering the esophagus. But when it goes wrong, when your swallow doesn't work correctly, food and drinks can enter your airway in the front here. And that's the worst case scenario almost, because when food and drinks enter your airway, your trachea and your lungs instead of your esophagus, and that happens continuously over time, you can get what we call an aspiration pneumonia. So aspiration means food and fluid or material entering your airway, and as a result of that, with the bacteria that is brought down with it, it can breed and cause the chest infection and pneumonia. So that's probably the worst consequence of a swallow going wrong. And it's not impossible for that to happen. It does happen quite regularly, especially when swallowing changes. Um, it can change with age, but it also can be impacted by other things like illnesses, injuries, surgeries that result in injuries, um, general fatigue when we're tired, and if you're disoriented, because that's where your senses come into play. If you're unable to see or smell what you're going to eat or drink, your brain lacks the information to plan that swallow. And when I'm talking about illnesses and injuries, I'm thinking of most commonly associated condition would be strokes. Post strokes, we see lots of swallowing changes because your brain is directly impacted. And so planning your swallow can become difficult, or your muscles might change as a result. We also see swallowing changes with other conditions like dementia, Parkinson's, and all of these changes can be long-term, especially with those who've got progressive conditions that I've just mentioned, or it can be temporary, like with the fatigue, if someone's more tired or they are disoriented temporarily, they can have swallowing changes during that time. So these are all whys of a swallow changing. But what actually happens varies as well. These are just some examples. People might find it harder to eat or drink things that they used to enjoy, and that can be specific textures, especially textures that are hard and crunchy, because it gets harder to chew or harder to swallow, and they feel food getting stuck or going down the wrong way. Coughing and feeling uncomfortable are key factors to consider if someone's reporting swallowing difficulties. But any reports of finding it hard to eat or drink is important to note and follow up with when we're thinking of swallowing changes. And I did say in some cases people can get sick, and that's referring to that aspiration pneumonia. So when food and fluid enters your lungs and causes a chest infection that can cause you to get sick, and in some cases it can be fatal. So these are all the consequences of an abnormal swallow when swallowing changes. The important bit is what we can do to, I guess, make it safer and make the swallow more effective or efficient. So I do have some tips for us to think about and talk about, and also implement it if you've got people around you or you yourself have swallowing difficulties. There's 4 main things that we're going to talk about. First one being eating mindfully. So eating mindfully is exactly what it means. It means think about what you're doing or what's happening when you are eating and drinking. So there's a few things that I've popped on here that are very universally useful for people to make their swallow safer. So sitting down to eat, and that means sitting down upright, about 90 degrees upright, because the more you lie down, the more likely that your food and drinks are going to go down the wrong way, because you don't have gravity helping you send your food and drinks down towards your food pipe, which is the right way. So sit down and making sure that we're focusing on the food and drinks that we're eating, so limiting distractions in that sense, especially for someone who's more tired all the time or someone who's disoriented. You don't want the TV running and them focusing on the TV instead of the food. So limiting distractions and talking while you're eating. Don't want to talk and eat at the same time, because you're opening your airway when you're talking, and food and drinks can fall back down the wrong way much easier. Taking your time. So slow is good most of the time. It gives your muscles time to do the right thing. Again, you've got over 26 muscles working together at the same time. So give them the time they need and try not to rush when you're eating and drinking. And one way to do that is to put your utensils down in between mouthfuls. So scoop it into your mouth, put it down, make sure we're finished, and then go on to the next mouthful, which I guess ties into the next point of chewing and swallowing, finishing whatever's in our mouth when we're eating and drinking before taking the next sip or the next mouthful. So it's all around that same point of taking your time and being slow rather than fast. And when drinking, sipping instead of chugging. I know sometimes when we're really thirsty, it's easy to go chug, 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 but you're not giving your muscles time to do the right thing if your swallow has changed already or is changing. So slow is good again. So, and the last thing is that you don't have to eat things that are difficult to chew and swallow. So avoiding foods and drinks maybe that you know causes you the swallowing difficulties. If you can piece that out, then just avoiding them would be helpful. Of course, you've got to balance that with how much you enjoy eating and drinking, and that's where discussion with a speech pathologist could be useful, because you can, in collaboration, talk about what foods might be important for you, how you might modify them to still enjoy them to some level, but also keep your swallow safe at the same time. So that's my first tip: eat mindfully, just focusing and paying attention to what you're eating, giving yourself time and limiting distractions as much as possible when you're eating and drinking. So that's tip one. Tip two is eating as independently as possible. So I understand that a lot of people, especially the clients that I do see who are much older, do require some assistance with feeding, especially when our upper limbs, our hands don't function the same anymore, or we're quite tired with eating and drinking, then assistance may be required. But as much as possible, eating independently is recommended. One of the reasons being that your swallow, again, starts before you eat. So whatever you see, smell, and you taste, all are cues to help your brain plan that swallow. And when you bring a spoon to your mouth instead of someone else, that's an additional cue that you're giving your brain to time and plan that swallow. So if you're being fed instead of being independent, then you're losing those cues, which means that your brain has less to work with to plan the swallow and tell the muscles what to do. So eating independently is recommended, but I do completely understand that some situations that's just impossible. So if you are assisting someone with feeding, ensuring that you're giving them as many cues as possible to help with eating independently, meaning that you're telling them what it is that they're eating and drinking. You're giving them information of what the food or drinks look like, where they're placed, when they're about to be fed, and following their cues for when they are ready to open their mouth and put the food or drinks in. But if you can, I would recommend looking into cutleries or other equipments like the cups that you see on the screen. Those are all things that you can talk to an occupational therapist about as well, to see if that's appropriate with allowing someone to be more independent with their feeding, rather than straight away going to assisting someone, so that we're encouraging that independence with eating. So that's tip two, eating independently. So we're mindful eating, and now we're talking about eating independently. Third thing is about oral hygiene. And this one, if you don't remember any of the other tips, this is key and something that we can do independently, or if not with assistance, without the need of a therapist being there. The reason why oral hygiene is so important for someone's swallow to be safe is when you maintain good oral hygiene, you're reducing the amount of bacteria in your mouth and in your upper respiratory tract. And the bacteria that is there is what we bring down into our lungs if you're bringing food and fluid into your airway. So if you're aspirating and food and fluids go down the wrong way, the bacteria in your mouth and in your upper respiratory tract, meaning your throat, is the bacteria in there is what we bring down towards our lungs, and that's what causes a pneumonia in the end. So keeping our mouth clean, there's lots of evidence about how it's 33% less risk if you're keeping your mouth clean and you're maintaining good oral hygiene. So that might look different for everyone. It could be toothbrushing, it could be flossing, mouth rinses, dentures, cleaning them regularly if you're someone who wears dentures, making sure rinsing our mouth out after each meal. And so consult your dentist if you need to make a plan, but maintaining good oral hygiene is key, very important to keep your swallow safe if your swallow is already changing and you're at risk of aspiration, which you will know if you have a conversation with a speech pathologist, and they will recommend this anyway, because it is a universal tip that we give out, keeping our mouth clean. Yeah, okay. So third tip done. Fourth one, and I guess one of the more important things as well, is to tell someone if you or a loved one experiencing difficulty eating and drinking. let someone who can get appropriate help for you know, someone like a GP, other carers, or health professionals if you're seeing any of them. So when you do let them know, you might end up being referred to a speech pathologist, a dietitian, or occupational therapist. And this is even if you've seen a speech pathologist before, you might always need a review, especially if things have changed and you're noticing new concerns or worsening concerns. A review is always good if you're concerned anyway. So let someone know who can get you referrals or the help that you need, so that you get access to either a speech pathologist, a dietitian, or an occupational therapist if you need to. Tell someone. Yeah. So those are the 4 tips. We had eating mindfully, eating independently, oral cares, and telling someone. And when you do tell someone and you get to see a speech pathologist, they can, with you, come up with something like this. So mealtime management plan is something that we offer here at Empower Healthcare as well. We come up with a 1-page guide of all the recommendations that we think about during the assessment. And this is something we do with the client and with the family as well. It's something that I don't just write down, this is what you do. We come up with a plan together and it's all written down on a single page like this. So it includes a date that it's created on as well, so that we know when to review it. And that's where I've mentioned that reviews are always indicated, especially when we've got new or worsening concerns. But essentially on the mealtime management plan, we include things like food and drinks, because often we recommend modified food and drinks to suit the person who's got swallowing difficulties. We find a texture that is safe for them based on the International Dysphagia Diet Standardization Initiative. We call it IDSI for short, if you ever see that term. And the numbers that you see here are based on that standard. So, for example, number 6, level 6, is what we call soft and bite-sized diet. So for someone on that diet, we recommend that foods are soft, so they're able to be smashed by a fork, and they're bite-sized, so they're no bigger than the size of the tip of my thumb. And then we do the same thing for drinks as well. We recommend thickened fluids sometimes, and this is always recommended by a speech pathologist. So do get a review or an assessment, an initial assessment if you need to, if you think that someone's not managing their food and drinks. Other things that we recommend are whether supervision is required and what type of supervision, whether we need someone to be seated with the person and assisting them, or whether someone just needs to be in the room monitoring how someone is eating and drinking. And then other things that we recommend are cutlery and dinnerware, and this is obviously done in collaboration with the occupational therapist on top of the client and the family as well. And safe swallowing strategies is what we have been talking about. The 4 tips are part of this. So you'll see remain as alert, sitting upright. These are all the mindful eating, and finishing each mouthful as well. So eating slowly, and regular oral hygiene, and eating and drinking as independently. So these are all strategies that we do recommend, and there's no harm to implementing them in our everyday lives while we're eating and drinking. The other thing that we do also sometimes recommend is using medication lubricant, and that's done in collaboration with the GPs as well. So we do add some pointers down here as well occasionally. And these in the red box are signs to look out for, whether it be yourself or some of your loved ones. Look out for any coughing, shortness of breath when you're eating and drinking, or even after meal times, and chest infections, as we talked about earlier as well. Any voice changes, like a gurgly, wet voice, like something's just stuck there, and audible breathing, or any other changes in swallowing difficulties that are reported. These are all signs for either a re-referral or a new referral as appropriate. So look out for any of those. If you've got, if anyone's popped up in your mind while we're talking about all these signs, definitely look into getting a referral. So tell someone about it so that you can have a speech pathologist involved if needed. But this is something that we do as part of our speech pathology assessment and intervention for people with swallowing difficulties. And I hope that was helpful. Thank you for attending the webinar today. I believe this is our last one. There are a few more here. If you're interested, you can register by scanning the QR code on the screen or visiting our website. I'm just going to have a look into whether we've got any questions in our Q&A box. And we do. Okay, so I've got the first question here that says, when I help my mum to drink, she bites the straw and won't let it go. When I try with a glass, it gets very messy. Why does she bite and not let it go? Good question. I don't think there's a single answer to it. It would be helpful to visualize what happens when this situation occurs. Part of it could be, I guess, just that behavior of wanting to have something in their mouth. It could be something that's soothing to the person, to mum maybe. If a straw doesn't help and a glass gets messy, try maybe something like one of those cups that I had on the screen, a sippy cup, or a two-handled sippy cup, so that doesn't get messy. With the biting and not letting it go, it might be the straw that's causing it. I wonder if that happens with the edge of a glass. If it doesn't, then a sippy cup might be helpful. But again, here's where occupational therapists might be, having occupational therapists on board might also be helpful to have these discussions, because they know way more than I do on what the options for equipment are. But I would think my next recommendation to try would be something like a sippy cup. And if that hasn't worked, I reckon it's worth getting someone in to see what's happening directly, so we can think of other options. I hope that helped. There is another question. If I didn't answer your question that you asked before, feel free to ask a follow-up as well. But I'll start answering this question that's been asked. It says, how can you modify food and liquid textures to make swallowing easier? Big question. There's lots of different ways. And again, it comes back down to the levels that I talked about. So the example that I gave was level 6, soft and bite-sized. So that's thinking about food. So modifying food can be tricky or easy depending on what kind of foods we're talking about. So for example, we can't really modify something like toast. So when we recommend that someone steps down or downgrades to a level below that, we're usually saying, let's avoid those textures. But something like cereal or wheat bix, if someone likes it, we can modify it by soaking it in milk or hot water if they're open to it, and that makes it soft. So we're thinking about making texture softer as we downgrade down levels. The most modified food is puree, so that's blending, blitzing it up. So it depends on what kind of food we're talking about. Again, if we're talking about, say, eggs and smoothies, those are all easily modified, but there are foods that we end up avoiding as well on a puree or downgraded texture. And with liquids, there is thickeners available that we sort of think of higher levels, meaning higher level of thickness. So depending on which level we observe is safe for someone, we might include thickener to that level, and that's what we usually recommend as well. So yeah, it really depends on what we observe the client to be safe on and what foods they like, so that we can talk about how we modify those things or what kind of foods we might need to start avoiding, and if the client is open to doing that. So it's really case by case basis. There's no universal sort of rule to it. Okay. So that's hopefully answered that question. And I've got someone who's asked, can these appointments be done via telehealth? Absolutely can be. We actually have started offering telehealth swallow assessments. So we can't offer these via telehealth. We just need the client and someone else who is tech savvy to accompany the client, because I would have instructions to get the person, the support person, to complete with the client themselves. So we do need a client and the support person to be available for these assessments to be done via telehealth. But yes, we do offer them, and they're quite successfully completed. So if you have someone that you can think of, feel free to send a referral through. And I've had someone who asks what can cause dysphagia. So dysphagia can be caused by a lot of different things. So I think there was a little bit of information I showed earlier about how illnesses, injuries, surgeries, fatigue, and general aging can cause dysphagia. So again, if anything's affecting your brain, like an injury like strokes or Parkinson's, like progressive conditions like Parkinson's or Huntington's, dementia, those alter the networks in your brain. And so as a result, your swallow can change. And that might be because the brain's not sending enough signals to your muscles, or it's not coordinating the muscles enough. So it might be a strength thing, or it might be a coordination. The reduction in those two functions can cause dysphagia as a result. Because just like you walk with your hands and legs because your muscles are moving, you swallow because your muscles are moving strongly and coordinated in a coordinated manner. So when those things go wrong, dysphagia happens, and we end up having to use safe swallow strategies or food and fluid modifications to manage that. So it really varies the reason or cause for dysphagia. And again, even if there's no change in your brain networks, aging generally weakens your muscles. You might find someone getting older finding it harder to get up or walk. Same thing with your swallowing muscles, they get weaker. And that means that sometimes harder textures can get harder to have. So you might need to swap out to softer foods in order for an older person to manage it because their muscles have gotten weaker. All right. And I have another question here. It's asking about someone who suffers from laryngitis. I've consulted with speech pathologists. Is there a direct link between a food intake and suffering from laryngitis? Is that laryngitis? I'm assuming it's laryngitis. Not that I know of, to be very honest. It might be, so I guess I'm going a little bit into how a speech pathologist and a dietitian do work together as well. So as speech pathologists, we think about textures of food and what's safe for them to swallow. Whereas I think this question is asking a bit more about the content of their food and how that might affect the laryngitis. Correct me if I'm wrong. So I might not be able to answer it if you're asking about specific foods and how that links to the laryngitis. But if you're asking about the different textures, from my knowledge, there's no direct link between the textures of the food and that causing laryngitis. But other things that go wrong, like if you're aspirating, it can cause inflammation in the area of your throat, or if food's getting stuck, it can cause inflammation. So really is a case-by-case basis, and I would not know until we do a few assessments. So I hope that somewhat answered your question. Right, from a dietitian's perspective is what you've asked. So yeah, I definitely can't answer that, but I would recommend having a discussion with a dietitian to find out more about that. There could be links, but I'm not the right person to answer them. We do have dietitians at Empower who are brilliant, and they might be able to help you out there. But definitely speak to your GP if you need some immediate support or any other health professionals that are involved. Perfect. Those were some amazing questions. Got me thinking a little bit as well. So thank you for those questions. I really hope today's information was helpful. And if you do know of anyone who does have swallowing difficulties, do try applying those 4 tips, including telling someone about it to get appropriate support. And I think that was the end of today's webinar.